Welcome back to Proactive Prudence. In today's session, we are diving deep into one of the foundational topics in anatomy and radiology, the joints. We'll explore their classification and focus in detail on synovial joints, essential in understanding the radiographic anatomy and pathology. What is a joint? A joint is simply the point where two or more bones meet, but it's more than just a connection. It allows movement, provides support, and gives stability to the skeleton. Classification of joints. Joints can be classified into two ways, structurally and functionally. Structurally, the classification of joints, there are three types based on how bones are connected and whether a cavity is present. Fibrous joints or synarthrosis. Bones are connected by a fibrous tissue, no joint cavity. These joints are immovable. Examples: sutures between the skull bones, syndesmosis like the inferior tibia-fibular joint, gomphosis where a tooth sits in its socket. So these are the pictures of fibrous, cartilaginous and synovial joints. Cartilaginous joints or the amphiarthrosis. The bones are joined by cartilage allowing limited movement. There are types in the cartilage joint as well, primary and secondary. The primary synchondrosis, joined by a hyaline cartilage, example epiphyseal plate, and secondary symphysis joined by fibrocartilage, examples pubic symphysis and intervertebral discs. The third type is synovial joint or diarthrosis. These are freely movable joints we most commonly encounter in radiology. There is a joint cavity enclosed in the capsule filled with a synovial fluid. These joints are pivotal in clinical diagnosis as well as in imaging. The functional classification. Based on movement, joints can also be categorized as immovable, slightly movable, or freely movable, the latter being the synovial joints, which we'll explore in detail. So, based on the function or the degree of movement, I have mentioned the example as well. Now, synovial joints in detail and radiology focus is also important. Synovial joints are crucial in musculoskeletal radiology because they are involved in most locomotion, sports, injuries, and arthritis and joint dislocations seen on imaging. The key features involve articular cartilage covers the bone end with a smooth hyaline cartilage, reducing the friction. Joint cavity contains a synovial fluid acting as a lubricant. Synovial membrane lines the joint capsule internally and secretes the synovial fluid. Fibrous capsule, a tough outer layer enclosing the joint. Ligament provides mechanical support and limits excessive movement. Brusae and tendons often associated to reduce the friction in high movement areas. Radiological relevance. Look for the signs of effusion, capsule distension, or cartilage thinning, joint space narrowing on X-rays, MRI, and CT scans. So the types of synovial joints with movement and radiological examples have been given here. So plain, the gliding joint movement is sliding or gliding. The examples are intercarpellary joints seen in wrist radiography. Hinge joint, the movement is flexion and extension. Examples are elbow and knee, common sites of trauma which is observed in X-rays and MRI. Pivot joint, or the movement is rotation around a single axis. Examples are atlantoaxillar joint, C1 and C2 vertebrae, crucial in cervical spine CT scans. Condyloid or ellipsoid joint. The movement is flexion, extension, abduction, or adduction. Examples are wrist joint, frequently examined in trauma and arthritis. Saddle joint. The movement is same as condyloid or plus rotation. Example, first carpometacarpal, the thumb, often affected in osteoarthritis. Ball and socket joint movement is multi-axial, allows the widest range of motion. Examples are shoulder and hip. Key focus in dislocation, fractures, and arthritis. So the radiology tips involve always access the joint space, width and alignment, and bone contour. Synovial joints may show changes in the joint fluid like effusion. cartilage wear and bone erosion in conditions like rheumatoid arthritis. Use MRI for soft tissue assessment and CT or X-ray for bony details. To wrap up, the summary of joints are not just static connection, they are dynamic, intricate units that allow movement and reflect many systemic diseases. As radiologists, understanding the synovial joint is essential. They are windows into conditions like trauma, arthritis, or infection and tumors that can be observed through radiological imaging. If you found this helpful, like and subscribe for more high-yielding anatomy and radiology lessons. Drop your questions below and stay proactive, stay prudent.